welcome back to this session. I need Dave on my left because, as you can hear, my voice is going, and I just hope it's going to last the session. I was thinking about this round table last night, about which I've been excited about for 2 years, and we finally pulled it off, and you're all here, which is just amazing. And it's something so sort of dear to my heart. I put a few thoughts down about what has stimulated it. And really my main concern is that piano performance is not a unified matter, although there are some who will say it is. So I'm just going to read you some of the thoughts that I had last night in my creative time at 8 o'clock.
Excellent.
So I said, since the ideas controlling piano pedagogy and performance have been largely allied to the structure of Western thought, which nurtures a mind-body dualism, I'd like to open our discussions with a brief account of some of the reasons for the dualism before we move forward. In 2000, Casey suggests that 2 developments occurred in Western culture, which contributed towards this trajectory of disembodiment, as she puts it. The first is that on the whole, Western culture grew to value the subjugation of the flesh for religious goals, a mode of thought which was in part, as you may imagine, influenced by the Greek thinker Socrates, 469 to 399 BC. And he writes, I quote, "It seems that so long as we are alive, we shall continue closest to knowledge if we avoid as much as we can all contact and all association with the body, except when absolutely necessary." So this is probably where we may say where it began. However, it is Descartes. Anyway, as I was saying, Descartes, who is steeped in Christian theology, argues that there are 2 classes of substance which makes up the human organism. They are first, he says, the palpable body, and second, the intangible mind. The second development, again according to Casey, which contributed to the hardening of the mind dualism in Western culture, which we still feel in piano performance, was the Enlightenment. During this period, it was thought, during this period, the mind was completely enclosed and isolated from the body, and the only certainty was knowledge, which was a collection of ideas and which belonged to the mind. This view, which assumed that the body is a solid object, while the mind is an ethereal subject, mysteriously infused into the body object, remained central to European thought until recently. Although today, Eric Clark writes that the body continues to be viewed as an impediment, I quote, to the all-powerful and self-sufficient mind, and this is despite overwhelming evidence provided by neuroscientists Damasio 2000 and Endelman 2007, that the mind is the site of mental phenomena and is fully embodied. Thus, with reference to their research amongst others, I propose that the piano performance does not depend on one or another part of the brain, but is based upon a global interaction, which involves both the conceptual fields and the sensorial motor system. As the philosopher Roland Barthes writes in 2005, a brain that is cut loose from the body and surrounding has no indicating or referential function. It refers to nothing, it indicates nothing, and it cannot even refer to itself, because it cannot locate with itself within the world. Now with that, I throw the debate open. And we're looking towards some kind of discussion which will put together, how would you like to say, a package, will put together something that we can take away and say, well, that might lead to a more unified way of looking at both teaching and performance. So we have pianists, 1, 2, academics, but I think everybody plays as well. They're good. You're a dancer.
I'm a dancer.
Would you introduce yourself?
My name is Dr. Suki Kanga. I'm a postdoctoral researcher at the University of Nice and a research fellow at the Royal Academy of Music, London, and I'm a pianist. I specialise in contemporary music.
Emma.
Dr. Emma Redding. I'm head of dance science at Trinity Laban Conservatoire of Music and Dance. So most of my research has been focused on dancers, but we are now working in music as well. So I'm dance trained, not music trained.
My name is Professor Dr. Beate Perry. I am based in Paris at the École des Hautes Études. I have a double training in musicology, my degrees from Cambridge, and in piano. And I work on the interfaces between the arts, performing arts and the visual arts, and was a director of interdisciplinary research project, which actually did something at Laban once about the critical languages one uses to describe movement and music and the arts that are particularly time-sensitive. In academia versus the performing world, there's a great chasm between those two. And so the project was focused on that.
Dave Collins had the misfortune to hear me earlier. Trained as a physical education teacher, performance psychology, doctorate in mainstream psychology, and actually in electroencephalography, brain activity of performance. Now, I would say that my approach to performance psychology is fairly integrative in that it's drawing on elements of conditioning, biochemistry, biomechanics, physiology, and psychology in terms of promoting performance.
Kathleen.
Hi, I'm Kathleen Riley. Trained 3 degrees, including my PhD in piano performance, and postdoctorally, I went back to NYU and took coursework in physiology, neuropsychology, biomechanics, psychology, ran several pilot research studies, and I'm now on more of the science end, where I'm on faculty at the Cleveland Institute of Music, where my specialty is optimal performance health. I teach courses in that. I have a biofeedback lab that all of our students are allowed to use. And I am also now on staff at the Cleveland Clinic Center for Integrative Medicine, doing biofeedback, specializing musicians for retraining or injury.
Hello, my name is Felipe Verdugo. Right now I live in Montreal. I'm a doctoral student at the University of Montreal. I also work in a research laboratory about the musician gesture, specifically in piano. Well, I come from Chile though, so I hope if my English is not so clear, you can just make a question and I can precise whether it was not clear. Yeah, that's all.
I'm only an osteopath, academic here. I'm Iqbal Hussain. I'm based in London. I have a private practice in London. I've been doing it for 28 years. And I treat human beings of all kinds. A proportion of my patient list is musicians of all kinds and across the board. I've been doing some collaborative work with Christine on theoretical, some of the things she talked about. We wrote a paper together as well. And my philosophy is working from basics. Patient comes in, we see the complaint of a problem, see if we can make him adapted to the job. And of course the piano is not that adaptable, so that's where the dilemma is. So we have to adapt the human being to fit the tool. Normal workstation assessment, office work in the bank is very easy, you can move things around, and piano is impossible. So that's one of the difficulties that I face. That's right.
What would you say that the majority of the pianists who come to you suffer from? Is it usually an upper?
It always is upper back, neck, upper limb issues, repetitive strain type of problems. All of them. Very, very few of them will come with low back pain. Very few.
What age group?
And lower limb would be the age groups. I've seen Christine, the youngest one I've seen was 17, and they're not, depending on the age, they're not really big issues, but most of them are misunderstanding of how the human form fits the tool. So once you've got through that and the pace of practice, there's a kind of feature, and I think there's a lot of work on in Scotland on the pace of playing and routines, understanding how having frequent break stretching, doing other activities rather than just piano, the life revolving just around the piano to make the human being, which give him a range of activities to make him fit better to the tool.
Would you say that you've ever cured any of them?
Cured it?
Yeah. No.
Absolutely.
So
not. We don't use the cure doesn't come into it.
I know, that's why I threw it in, because people are looking for a cure, but they're not looking for prevention. We talked about this before.
Precisely.
Proactive rather than reactive.
Exactly. Well, we're talking about it now. They're doing the work in the States on getting a baseline reading on each of the students, and my student college doing a little work on that to get a baseline reading of how one is performing before problems begin. So you have a start point. You can't use universal gradings because every human being is completely different apart from male and female. Of course, stature, arm length, finger length, flexibility, muscle tone, genetics, previous injuries, the list is huge. how stressed the person is. So getting a baseline reading will give them something to work from, a sort of a springboard. When future problems do occur, they know where things might have gone wrong. But I think, as we talked about this before, people are loath to take any advice, because, especially young players, because you might tell them, well, you've got a particularly tight carpal tunnel, so the sheath movements in your tunnel are quite tight. So you introduce specific exercise, but they're perfectly fine, they don't have any symptoms, they won't do it until it's too late.
But that's why when I'm using now surface electromyography, and we're actually showing definable outcomes and really clear data that students can look at. And as we discussed earlier, I mean, muscles fire at a very high level for a long period of time before pain actually presents itself. So I have had the fortune of being able to do these baseline assessments on the entire incoming class at the Cleveland Institute of Music. And what was very interesting is that these happened before these students actually went to their teachers. So this was the incoming undergraduate class. So that we have baselines. And when there were the red flags, I made recommendations. Now, some of these students decided not to listen to me, but that's okay, because they said to me, well, you have the data. It clearly shows that this problem was here before the students started studying. And then we will be tracing this. So we will be doing another reading on them at the end of the spring semester, and then we will be doing a reading again in the fall. So we are hoping to have a lovely 4-year study on the incoming freshman class, where we can track and see if the fact that we have a real mandate and a philosophy now at the Institute of Music of embracing wellness and of really doing something to make sure our students are not playing in pain, and we want to track and see how many of them are A, listening, and B, if this is in fact helping. I was amazed on Tuesday when I was able to make a call for a cellist who came in to see me and clearly had shoulder pain, and I recommended her, in addition to doing work with me, looking at the movement, going to see the osteopath that I work in tandem with in Cleveland. And I was able to call the director of the orchestra rehearsal schedule. And I said, this is Dr. Riley, and I just saw so-and-so, and she really has some severe shoulder pain. My recommendation is that she be excused from orchestra rehearsal for today and the rest of the week. She says, oh, fine, no problem. And we made it happen. That never would have happened 2 years ago. I wouldn't have been allowed to not go to the dean or talk to someone else and make that direct call. I made the direct call. The teachers, the faculty, everyone's listening. So that's a huge change, I think, in our culture of where we are, and the fact that, we see things in what the body does, and I think we'll be able to talk about gesture and our language of how we describe things. But many times when I look at a student and I talk to them in terms of their physiology, they'll look at me and say, oh, that's what Miss Olga meant when she said blah, blah, blah. But she said it in descriptive terminology. But, as teachers, we can say the same descriptive terminology to 5 students. They can sit in a classroom together, and that would become interpreted 5 different ways into their physiological profile. Completely different understandings. So to clarify that, we need to bring this bridge in terms of language and how we're defining things to marry the descriptive with what does that mean physiologically.
If I may, I'd offer 2 inputs to this. The first is that across most of the work we're doing at the minute, which is including military special forces, sort of 35-ish-year-old professional sportsmen, that's getting on. I think it's great, but they're getting on. What we're seeing is that when you've had a lifetime, the East Europeans used to talk about the level of qualification. It was the number of training years you banged into your body. So typically, if I start playing piano, at what sort of age? 4, 5. Okay. So come 14, 15, 16, I'm getting 10, 12 years of training. That's pretty heavy duty. If I only do that, what I end up with is a very restricted, narrow band of very specialist movement. Literally, my movement vocabulary is very limited. When I face changes to my movement, because someone teaches me something, or I grow, or I get stiff, I haven't got the wider movement vocabulary to fall back on. So actually what we do is we intersperse blocks of specific training in whatever it is with what in the old days would have been called agility training. What we're calling is general movement ability training. So we do a very sort of general set of movements, and that seems to have a prophylactic effect, preventing injury, and it seems to give the person the capacity to recover from injury, where in sport and also in special forces they're very clumsy. Inevitably you're going to get injured. So that would be the first thing. The second thing is the language thing. There is in my field a thing called communities of practice, and it's from not from sport. It's used a lot in coaching, and it's the idea that if you've got a group like this, this could be a community of practice. We could sit here and we could have we've had lots of discussion on what's going on, and I think your point about the different specialisms and how they communicate is key. But to do that, there are a couple of things we need. One thing is a common set of parameters about what it is what we're actually aiming for, and that's hence this conference. But secondly, which is why I'm particularly interested in the language side, is we've got to have a common vocabulary. Because without a common vocabulary, we're snookered. So if you talk about anxiety and that means something different to me and it means something different to you, all of a sudden we can't, it's almost like we have to have that common vocabulary to frame the problems so we can go, so that's the problem, let's get our hands on it. And without that common vocabulary, we're always struggling because we're all trying to kill a slightly different dragon. The minute we can go, so that's a dragon, that's what it looks like. Okay, fine, now we can handle it. So that would be the two things I'd pitch in.
That lack of a common vocabulary is probably one of the reasons why a great deal of unease is sort of stirred up when we have this kind of discussion amongst a lot of musicians. I think they are concerned about the vocabulary and they don't really quite get it.
And the word practice, that could be learning a skill, embedding a skill, pressure-proofing a skill, or refining a skill. The fact that you'd use the same word and the same procedures for four immensely neurologically disparate processes is an example.
Emma, do you have a name for getting a common vocabulary in the dance area? Or do you understand each other better?
Well, there are different movements. We use different movement vocabulary depending on the style that we're learning. So ballet vocabulary is very different to contemporary. But I think teachers often misuse certain terms that relate to physiology, and that's confusing. They might use an image that is kinesiologically incorrect but kinesthetically feels right. And that's quite confusing, especially when students start to get to know their anatomy a bit more, and then they can kind of question the teacher or be quite confused as they're taking on. So an example is teachers often say, swing your leg as if you're pushing it from underneath. So use the underneath of the leg to lift your leg high. And we know that muscularly that's not how we lift our leg. So students then get confused, but actually it produces the right visual effect, and kinesthetically it feels right, the dancers say. If we were to say, use the quadriceps, hip flexors, get the leg up, I think the pelvis would tuck under. Well, there have been some studies that looked at this, the pelvis tucks under, and qualitatively it's incorrect. So that's really confusing. But if we tell students that this is the case, that sometimes imagery isn't anatomically correct, and I'm sure the same is in upstream music. Yeah,
I think you're probably a little ahead of where the music is in that. I know from what Gary's doing, also the dancers they have a little bit better understanding of their muscles. And I think, and I say it at the end of my talk later this afternoon, what do I recommend is that we have a little bit of education for our musicians and for teachers in terms of what do we need to know at a one level about the body. What are the muscles? What are some of the basic understandings we have to learn about how everything is connected and how everything fires? And then we can use descriptive language. I mean, I use a descriptive language in some of the breath work I do that actually has no physiological basis in the body, but I explain that as I'm saying to them. I'm like, you're going to have this sensation that physically can't ever happen, but if you imagine it, something changes in the body. But I'm very careful to define this is not actually what happens, but I want you to see, sense, imagine that this does. then there's no disconnect between the fact that, oh, I'm still breathing through my nose.
Can I support that? There isn't a necessity to do Physiology 101. It's handy, but you could have a whole so martial arts, yeah, I do karate, I do judo. You'd have a whole vocabulary, which is pidgin Japanese often, but it's in Japanese, that says, well, no, I understand. Yeah, and so long as you defined it, yeah, it doesn't matter. So if I've worked with sort of 5 and 6 year olds, because if they're young enough to worry, they're young enough to do something about it. And we invent our terms. So we have jelly belly, sticky bits, Zanussi stomach. Yeah, and it doesn't matter because we all know what we're talking about, and that's okay. The kids invent it, and I just pick it up, and that's okay. And I mean, I'm having been laid on the table for various bits of carving from colleagues of your profession. Again, when I mean, clearly there is an immense jargon field, but then. There is then if you're looking to me as more than just the bloke having his knees replaced, then all of a sudden you need to talk to me in terms of kinesthesis. And kinesthesis is immensely powerful. So this idea of analogy learning, and kinesthesis is absolutely tickety-boo. So long as you define and you get common agreement. So what does it feel like when you push your leg up from underneath? And what does it feel like when it doesn't? Gotcha. Okay.
But then I like to also, on top of that, they do it correctly, and then I take the next level and I explain, but this is the muscle, this is what's happening.
Yeah.
So that, and I say that why do I want them to know certain muscles? Because many of the medical specialists that they go to do not have any idea what they do as musicians. I have a few very dear colleagues at the Cleveland Clinic who actually watch them on their instruments when they go in. Very few. But most of them have no idea. And I say, I want you to be able to talk about your upper trapezius. I want you to be able to talk about your forearm muscles. I want you to know certain things so that you go in there and say, hey, this is where I'm feeling something. This is what I know. Can you help me?
Well, this is one of the problems that we've got in my practice broadly is language. Patients come in and say, I've got a slipped disc, and they literally imagine a stack of coins with one of the coins sticking out as a slipped disc.
Right.
But this is pedalled. And it's probably true in any field. And one of the biggest, what I was talking about going back to basics, is explanation to patients. I don't do anything until the patient understands their problem. But not in scientific terminology. It means nothing to them. No. It's got to be analogy and in practice. It's got to be able to put it in practice. So if the end result, you can over-scientifize this and say, okay, fine, it's this muscle. It doesn't really matter. They just want to be able to practice again. I mean, at the end of the day, they want to feel right. So yes, physiology doesn't have to be at one-to-one, but I think in terms of practice, you need to be right on top of the student.
They need to be aware of what is starting to not work.
Exactly.
They don't need to remember everything, but they need to have that basic understanding and how everything does work together.
This is something I was working with kids. A lot of problems I'm seeing now is children with their school bags. They expect to take everything at home with their rucksacks. We're about 6-7-year-old kids who are getting terrible neck pains, migraines, headaches, all kinds of things. We're trying to, it's not going to work because what they really need is a pulley. But it's just not fashionable. Kids aren't going to walk around with a pulley. So we're trying to develop that and explain to them what is happening and why it's important to leave things at home. Because imagine if they can carry it, they'll find all the mates are doing, they're walking around round shoulders, causing terrible problems.
I dropped one other thing into the puzzle.
Yeah.
I was a performance director as a guy running a program with doctors and physios and coaches and strength and conditioning specialists, or as an advisor to a football club or a judo academy. I want my doctors trackside. I want my physios pitch side. Yeah, as much as I want my coaches talking to the physios and the doctors over coffee to be able to go. So he gets this sort of thing because it's that closeness of, and with the greatest respect to the medical profession, very common where you've got doctors who are doing 2 days of that and 2 days of that and a clinic in that and you just don't get that. So now,
it's too remote.
Yes, exactly. Because now, of course, the language is crucial. Because if I come into you and say I've got a, C1, C2, or zongular tendon is my favourite. Yeah, there isn't one. I think. So you watching. And you then talking to the coach, the teacher, the professor in this respect and saying, see there's what I'm talking about.
Well, my best teachers have been my patients. Father Lang, I think you said that, Zanussi and all that.
Yeah.
Patients come with terminology. I say, well, that's a really good analogy. And I pick that up and it works very well across the human race. It's no good trying to work things out scientifically and what textbooks say, so it just doesn't apply in real life. And I imagine you've got the same problem. I'm just picking up on what you're saying about, I don't know what a course in music is like, because I haven't looked at the curriculum, but I imagine there has to be, rather like in physical ed, there has to be something in there about body awareness, about exercise.
That's what
I think it's critical.
what we're doing.
It's what you were saying about learning patterns of movement, which are only particular patterns of movement and nothing else. Or maybe we need to talk about extensions of things like Pilates or basic stretching. I mean, it's all very basic stuff.
One of my best examples of what an understanding would be. You know, I give the simple movement and I say, okay, everybody in my class, move your forearm up and down, okay? And they do this. And these are my favorite answers. I mean, I should have these on tape. Okay, which muscles in your body move your forearm up and down? And they sit there and they think, and someone will go, my shoulder, and I get elbow. I'm like, well, that's a joint. You're getting warm. Someone else will go, oh, my hand. Well, no, that's after the arm moves. And then someone will start thinking, they'll point. And I'll go, yeah, what is that? So we go bicep and tricep. So then I say, okay, well, if you activate this bicep and tricep, do you need to lift your shoulder to move your arm up to the piano? Or to move the forearm? And they go, no. So I have them put their hand on here. It's okay, activate your bicep and tricep. Now, if I have them hooked up with electrodes on their shoulders, the minute they get that concept and they separate those two, the shoulder muscle doesn't fire. Voila, we get up to the keyboard without this. But 90% of the time, what's the first perception? Misperception. How do I lift my arm?
Well, the thing is, let's peel it back a little bit more. It's this thing about analogies to make, like you said, to make the students interested. And then you try and become technical, give them some more detailed advice on physiology. At that point, I have to say, after 30 years of teaching at Royal Holloway, every single student glazes over. And they are not interested.
Do you think they need detailed physiology? I mean, as in textbook physiology?
No.
Well, no, but on the basic lines that Catherine's talking about.
Yeah,
how do you get to the...
And then they never forget that.
In practice. I'm talking about more practical application of the theory. Basic anatomy. So you can teach them basic... I don't know. I mean, I haven't elaborated this in my head, but I mean, I presumably they need some basic anatomy, of course, but they're not interested in the micro details of how neurophysiology...
So what would be your experience?
It can help though. For example, for one student I had, I told her, okay, she was really playing this way, let's say that for us, from my point of view, it's not so effective. So I tried her to use straighter fingers, and I told her, well, this joint, this phalanx is controlled by the muscles like inside the palm. So that was the only description that I could give her, so she understands how to use it. And before I was trying different things, and it didn't work with like descriptive language, and it didn't work. So for some of them, it works like a really physical or physiological facts. And maybe for everyone it's going to be good some, I don't know, descriptive.
So for a punctual situation, in fact, Christina and I were talking about the crane movement, we used the analogy of a crane, for example. I mean, it depends on the student, I agree with you, but I think broadly speaking, people who will understand better what they see around them in nature. It's going to make a lot more sense to them. They're not scientists, we're not going to try and make science out of it. But this is why I think analogy projections have to be made and set up. And Zanussi is a great one, I love it.
Just to add on to that, I think you don't want to make them scientists, but in a way there's a difference between this kind of learned and knowledge of how the anatomy works and the kind of embodied knowledge that you require to actually play the piano, play very complex music, which most piano music is, compared to most other instruments, because you have many, many different lines, many different things happening just in a single hand. So actually to try and understand what you're doing in terms of the actual, what each muscle is meant to be doing, actually you can't really control that and then somehow then apply it to a fugue that you're trying to learn. And I think that's why using some of these metaphors can be very useful as a way of kind of fast-tracking a way to get into a physical way of approaching something rather than getting into too much detail, which might confuse a lot of students.
That's right. It's when you were saying they glaze over. At that point, you've lost them. Then you need to get into practice. Exactly.
There are two other techniques you can use. I'll go with one. the human body is staggeringly good at spotting contrasts. It's very, very good at going, well, that felt like that and that felt like that. So, for example, your situation, play like that. Play like that. Really accentuate that. Really accentuate that. What's easiest? Oh, actually, that feels better. If this feels better, it's that. Yeah, if that feels better. Okay, fine, go with that. And what does that feel like? Oh, well, I'm feeling this. Sweet. Get on with that. And actually, that sort of contrast training is a major element of what we do when you take an automated movement, a well-learned movement, an internalised movement, an autonomous movement, and then say, actually, I want to refine that. I want to make a change to it. You must almost call it into consciousness. And you can call it into consciousness by going, well, actually, concentrate on this bit. Or you can say, so what would it feel like if you really, and that contrast is very powerful because it calls an automated movement. This is not during skill acquisition, this is during skill refinement. It calls back out of the black box, if you will, that technique. You can tweak it and you can put it away again. It's a long process. Look at Tiger Woods if you're into golf. Yeah, it's a long process. But if you do it that way, it works.
Of course, you're in an ideal world because you have all the support people around one sportsman, for example. But students mostly are on a one-to-one basis, and they have to take it.
But not necessarily.
No, but I'm talking about piano teaching.
Oh, no. Yes. But what I'm saying is not necessarily. What I guess I'm saying is that if a golf pro, classically, is, they're paying for lessons, but I guess your guys are paying for lessons as well. So a golf pro is working one-on-one with a not by no means star performer and trying to make him or her make changes. And you can do it in a very routinized, procedural way, which means that they keep coming back to your lessons.
I think more routines like football.
Oh yes, for sure. Yeah. But in actual, but what I'm saying is that for me, if you're a good pianist and you've never been trained to coach, you're going to be a pretty crap piano teacher. Sorry, yeah.
Wouldn't you all agree that actually we're not trained to coach? Is that the case? You're not trained to coach.
Yes.
Okay, so
I'm known great teachers, great players who are better teachers.
Indeed, that's very common. If you look at the number of great footballers who are now great managers in the Premiership, yeah, not those who say they are, but those who actually are, and there aren't too many.
Yeah. But this boils down to basic communication skills, and I find this when I'm teaching osteopathy as well. They don't teach communication skills to patients. How are you going to communicate with your patient? They come and tell you everything. So they get a case history, it takes about 20 minutes or whatever. But now you've got to convey, you've got to assimilate that, digest it, produce a diagnosis, and tell the patient what's wrong with them before you start treating them. Well, if you're going to start talking in scientific language, you can just forget. Most of them are not even interested. They just want you to solve their problem. If you want to stop them keep coming back, you've got to explain to them the nature of the problem and how they can prevent it. It's about prevention. We're back down to the same thing. So in this situation in colleges, I imagine, because the teacher is going to be, with the children in school, it's going to be the same. You've got to train teachers to then impart knowledge one-to-one, because most of the detail is not going to happen in a class of 20. It's going to have to be one-to-one, hands-on.
It does.
Absolutely.
And the other thing to be very mindful of and careful of is that to the naked eye, we could be getting someone to do a proper gesture. And gesture does not always give us a window inside as to whether the muscles are actually releasing. And what we're really trying to optimize in high-level performance is a cycle of tension and release.
Yes.
Same with sports, right? So the importance is the release.
And this is why learning is so tiring. Because you're like that.
But to someone who has been doing that, or is a very, I want to use the word hyper person, they come in, oh, how are you? Okay, well their level of, their baseline to them of where that muscle activity is here all the time, so that's their baseline. They're totally comfortable with that. So if you start saying to them, well, you need to relax, they'll say, well, but I am relaxed. I am. I mean, really, I'm relaxed. You know? And so why do I love the visual? Because then I could say, well, yes, okay, you're here now. Do you think maybe we can get down here? Now, I have their attention. Now we can start doing analogies. Now we can start talking posture. Now we can start talking shape.
Yeah.
But seeing is believing. All of a sudden the lights go down. Now, we don't all have those tools, but we do have ways to have parts of the body as markers, okay? Like, you know, in dance, there's certain things that you need to show them that will be their marker for when they're relaxed. For music, it's often the elbow. If the elbow is not locked, then we can move. The shoulder is more relaxed, the wrist is flexible, and the hand is in a more optimal position. So we have to be sure that in our toolbox, in our language, that we've got the places to teach where the relaxation is.
I was fascinated then in the language then that you would be looking at the individual's use of language, or the individual's communication with a teacher or a mentor?
Let me get to that question via detail. In general, in the West at any rate, it's very true what you said, that there, or what you were wondering about and amazed about, that there are very few conservatories who have classes in anatomy. There's one part of the world that has had classes in anatomy for musicians for, not centuries, but for decades and decades, and that's the Eastern Hemisphere. It's Russia and Poland. And it's not a coincidence that that's where very, very strong players actually are coming from. But what these institutions very artfully have managed to do on top of anatomy classes, which are by definition very scientific, is that they use a great deal of imaginary teaching that does not rely just on the technical aspects as described by a physician, for example, or the analytical findings as could be described by music analysts, but rather through stories. Russia is, as everybody knows, a great country of the theatre, and what was discovered in theatre studies was adapted for the musical world. So, to come back to the issue of gesture, what I find most fascinating and most interesting really is that when, and you probably as a physician will confirm this, is that when a person is moved by an emotion, a certain gesture is going to be produced. And that gesture is not going to be reflective. It's not going to be something that you first think about. It's a reflex. And as soon as you have got a storyline and emotional content that goes with that storyline, the gesture is going to come much more easily to the person. Mm-hmm. It's not something that is artificial, but that is actually generated from within, from an emotional point of view, not just a physiological point of view. So the gesture itself is really just a result coming from something that is happening somewhere in the mind and in the heart, somewhere in those two places. So piano playing, from my point of view, really is just as in sports, a certain collection of movements that are coming back across the entire repertoire. And they need to be fine-tuned, and so that's where the repetition comes in. But that's also why, for example, a pianist cannot pick up the violin, or a golfer cannot go and suddenly be first class in tennis. These are very, very specific movements. And as long as they are learned in a way that is physiologically kind to the body, the artistic work can actually happen.
Right, but that's, I think, with emotion. One thing, a lot of times the natural tendency of the body when we emote is to pull in. So we, in teaching that storyline, and very much in terms of gesture, we're really training and making sure that the gesture is outward and not pulling, because I call this the Bermuda Triangle. Everything that goes in terms of holding tension never comes out. So why is there so much problem in the neck and shoulder? We want to suck it in. And so those gestures, and when you're telling the story and you're getting that creativity across, has to be that there's this super highway from the ear down to the hand. And it has to go flow outward and not suck inward.
An example. Figure skating, you do a triple. Okay? When you do a triple, so imagine I'm a figure skater, I look great in the skirt.
Yes.
So I'm setting up and I come into the spin. When I come into a double, and I can do a double, piece of cake, I can't, but imagine. Then piece of cake, and what I do is I go in and I come in and I toe loop and I'm like this. So when I now rotate, I rotate over an axis with a very small axis of rotation. Make sense? So I spin quick. When I come in for a triple, I go, bloody hell, I'm coming in for a triple. And you're absolutely right.
Yep, you lock it.
And now I take off like this. So now my axis of rotation is wider. There's more of me. So I rotate 2 7/8 and land on my bum.
Yeah.
Now here's the crack. Do you say, don't tense up? No.
They're going to get more tense.
Absolutely. So what you do is say, you use some analogy, that is,
That's right.
high chest, or high head, or iron rod down the mid, doesn't matter, but what you do is do that. Yeah? And do that is super more powerful
Go in the back
than
door.
don't do that. And then you get the spin. Just out of interest, another study which shows that psychologists are really bastards. They're practicing putting. And you've got a group that practice putting and in their head imagine the ball going straight down the hole. And you've got a group that practice putting but imagine it missing 3 inches left. And the group that succeed get 30% better with the positive imagery, and the group that don't practice failing get 50% worse with the negative imagery. So negative imagery is much more effective at making you make mistakes than positive imagery is at making you. So don't do that. Don't mention the war. Don't knock the water over. Is the kiss of death. However, it's immensely common in the language of coaches, parents, teachers.
Felipe, I've cut you off. But he's looking very keen.
Yeah, it's just that there was one idea that really I found really interesting. The idea of trying to let this part not be stuck here. And this relates also to another thing that I wanted to say before about the relationship between pianists and scientists. In general, when we talk about muscles and how we use our body to play the piano, we always focus in the upper limb movement, which is here. Yeah. So the pelvis, the spine is treated mostly just for posture, but not for really technical specific recommendation in specific context, musical context. So this means that I think from the approach that I've been learning for the past years, that to be able to free to let this part of the body like free to be able to play and use well the upper limbs, we need the support and the movement of the muscles of the center of the body, and this is not treated in scientific literature for specific technical problems. Absolutely. So I think from pianist point of view, it's really important to learn from anatomy, physiology, etc., basic knowledge, but always from the scientific point. It's important to know how technique works or how different technique in piano playing works. So, for example, I have read, I'm not a scientist, but I have read for my doctoral research different papers about biomechanics of piano performance. And in general, the technique used to for the, how do you say this in English? For example, the research, they take 17 pianists to play one specific passage, okay? So they don't include the technique the pianists used in the research parameters. So the conclusion made from the studies is biased by the technique used for the pianists, these 17 pianists. So I think if you use your body this way or this way while playing, will make different results in the sound of the music and in how you use your body and which muscles you are using to produce this sound. So I think there is a lack of, there is a gap between both fields that is really important to...
Could I draw Emma in? Because to me, you have this ideal world where you seem to begin with movement, which is how I feel a piano teacher could also be engaged with that. How can we imagine the movement before we ever start? And that, of course, requires the knowledge we're talking about. But with dancers, it is all about that. You can't have a ballet without movement. Equally, I would say you can't have a performance without movement, but that's very often disputed. But
no, I mean, it's true. I mean, yeah, we do a lot of work without moving. So we do a lot of work where dancers are lying on the floor, and we get them to develop a much greater kinesthetic awareness of their body without moving, and then we move very slowly and try and get them to apply that same level of consideration to how they feel when they then get up and do a complex series of movements. Because if they've been working in a particular way, you know, we are what we practice. If they've been practicing in a particular way and are concerned, for example, with how they look in the mirror as opposed to how they feel if they move, then it's quite hard if they're doing a complex sequence to say, now think about how things feel as you move. So we get them to work very slowly, without moving to start with actually, and then slowly, and then build them up so that they develop a proprioceptive kind of awareness rather than relying always on visual input, because of course they're dancing in front of the mirror all the time. So you know, people think dancers have got heightened proprioception, but actually because they're using visual feedback, which is a slower way anyway of getting, you know, a message to the brain as opposed to using their body to sense where they are. That causes some issues. I don't know if I answered your question.
Are they willing to work with us though? Because it requires a great deal of patience. It's not.
They're really bored at the beginning, and when we had don't do it with first years. See, this is the problem. Do you do it as they come in, get them to this kind of neutral place, but then they just want to dance and they get bored, and they don't have the sophistication either. Or do you work with them halfway through, and perhaps then you come and try to strip them down and change their practice strategies?
It sort of leads me really to the final point that we might just all quickly look at, is that the problem seems to me that students are totally obsessed with the idea of the goal. They've got to get this piece, they want to dance this, they want to do that, and actually the process is not of any great interest. The process of achieving the goal is not terribly interesting to them. They want to get the end result. They want to come back and impress me with the piece. I don't want to be impressed with the piece. I want to see a process in place which will stand them in good stead for the rest of their lives. But I wonder how you think we might tackle the subject of goals. How can we reduce this desire, probably Western culture, I'm not sure, to achieve a goal, to have something to show for it?
Two things.
Yes.
The how, what, why that I showed you earlier is for me pretty crucial, because you're in I don't like the word, but it's absolutely accurate. You empower the performer to say this is what she or he's got to do. So I have to have a good understanding of the how, what, why. Yeah. Now lots of coaches and teachers across performance domains won't tell why. I know you bloody do it. It's very often the sort of the attitude, and that doesn't work because the extra bang for your buck that you get when the learner understands why and how and starts to take charge of it is pretty substantial. So that's fine. Slight disagreement.
Sure.
Sorry. What you need to say for me. If I, as a scientist advising coaches, I have to have a pretty good understanding of what neurologically is happening. So, for example, I know that, may I borrow your hand? If you don't move, and I move your fingers across a surface which is of different roughness, or I get you to move your fingers, away you go, across a surface of different roughness, the acuity, the accuracy with which you will feel is about 10 to 15 times greater when you move than when you are moved. Now, for example, grabbing hold of your client and whamming their limbs about probably doesn't happen too much in piano. Happens lots in tennis, depending on the attractiveness of the student. But it's something that you go, no, don't go there, because when you go there, you actually set up a wrong feedback loop. So I'm worried. In sort of intrinsically, when people do stuff in slow motion, or when people do stuff passively. Yeah, and there's reasonable evidence for that. So I guess what I'm saying is that part of the training of a coach of music, teacher of music, professor of music, whatever, would have to be not a neurology 101 or physiology 101 or even anatomy 101, but look, there's a number of different options you have. I can see exactly why you might use that at certain times. And therefore the crack for me, if you're teaching me to be a teacher of dance, which would be scary, is when would you use that and when would you not? So you circle all that round and you come back that the fundamental skill of the coach is in professional judgment and decision making. When would I use that technique? When would I not? When would I work on the core? When would I not? When would I be concerned about shoulder? When would I not? And now I communicate that, and now we're part of the way down the line towards the nirvana that you described.
What about sort of repatterning though? Because I think the reason why we do slow work, because I mean it is an issue. We do debate this all the time. It's not passive. We don't have somebody else move body parts, but we will work with them slowly because sometimes they've picked up a certain movement that looks incorrect. It seems incorrect. Maybe they're just overly using one muscle group as opposed to another, and to repattern that. Our senses, it works when you do it slowly. Then if we were to say, don't grip certain muscles, don't grip the gluteals when you lift your leg in arabesque. Really think about the hamstring, for example.